New details on the discovery of EEE in southern New England.
Tonight, the city of New Bedford has announced it's closing all parks at dusk due to the risk of EEE.
As we first told you yesterday, the first positive sample of EEE was found in Rhode Island in Central Falls earlier this month. Tonight,
we're hearing from the Department of Health on what the symptoms are of this serious disease. Meteorologist Pete Mangione has the important information you need to know to stay safe.
As much as we try to avoid them, mosquito bites are just a part of summer. But what should we do when the symptoms go beyond just having an itch? This summer in New England, when we hear a mosquito buzzing, it's hard not to think about the possibility of the EEE virus.
For some people, it can be extremely serious.
Joseph Wendelkin from the Rhode Island Department of Health says the most serious condition caused by the EEE virus is encephalitis, or a brain infection. Symptoms include
vomiting, diarrhea, fever, restlessness is something else that people might experience.
Wendelkin says even if you do not develop a brain infection, the virus can attack the body in other ways.
With that experience, it'll be more chills, fever, malaise that someone might experience.
Although mosquito samples testing positive for EEE were collected in Central Falls this month, Wendelkin says human infections are extremely rare in Rhode Island, with the last one occurring in 2010. A human EEE case was recently confirmed in Massachusetts, and aerial mosquito sprays have been conducted in Plymouth and Bristol counties this month. The Bristol County Mosquito Control Project tells Eyewitness News that a ground spray was already performed in New Bedford early Friday morning, and a second will be conducted Tuesday. Back in Rhode Island, even though the odds are very low, Wendelkin does have some advice if you are concerned that you might have EEE.
If someone ever has any questions, they can always call a primary care provider. If they just don't feel right, they have some symptoms, it never hurts to contact your primary care provider.
The Rhode Island DEM tells me that the risk of EEE is much lower in Rhode Island than in Massachusetts, so as of now, there are no sprays planned in the Ocean State. I'm Pete Mangione, Eyewitness News.